Another therapy that I'm very excited about is spinal cord stimulation therapy. I've been performing this procedure for some 7 or 8 years now since I've been in practice. What is new is transverse tripole stimulation therapy. What this consists of is the fact that a few months ago, the only thing available to patients was 1 or 2 leads inserted into the spinal column to deliver electrical stimulation to block some of the pain signals that was causing their back or leg pain. What we've always known in the field of pain medicine is that they generally responded well to blocking hip, buttock, or leg pain, but for back pain it had been difficult to cover. I recently went to Medtronic's headquarters in Minneapolis a few months ago and spoke with them about a new form of therapy that they've been working on. Some trial experiments have been done in other hospital settings around the country. The information I received from there I brought back with me to my clinic, and it was only a week or so after coming back I had a patient who had a spinal cord stimulator in place, and the battery had expired. It was time to replace it. She had both back and leg pain, and only one leg had been covered very well. When I spoke to her about the new therapy that was out, she was excited about trying it, and as I was too. I took her to the operating room a week later. We took out her other spinal cord stimulation lead and the generator needed to be removed, and replaced it with 3 leads. What I was able to accomplish on the operating table that day was that her coverage for her hip, buttock, and leg was done very well with just the 2 leads that I'd placed initially. When I then placed the 3rd lead in the middle between the other 2 leads, and we then turned on all 3 leads, the amount of coverage that she attained was 6 dermatomes level higher. The L4, in other words, the 4th lumbar vertebrae, was as high as we were able to accomplish coverage with the 2 leads. When we inserted the 3rd lead and turned on all 3 of them, we were able to raise the coverage of her back pain and her leg pain up to the 10th thoracic level, which is 6 levels higher than just 2 leads alone. So this form of therapy has been very beneficial to my patients. Since starting this therapy a few months ago, I guess now 8 or 9 months ago, I've trialed or implanted, and across the board they've done very well with this. One thing I can say now is I'm consistently better able to cover back pain with a 3-lead stimulation therapy than I was with 2 leads before, and the patients have responded again very well to this. To speak a little bit more about spinal cord stimulation therapy, the leads that are implanted into the epidural space above the spinal cord have different contact sites on them. When I place 3 leads in, I have a total of 16 contacts. They can be either in an off position, be a positive or a negative pole. And by arranging these different arrays, combination of these 3 leads, we're able to do 2 things. We're able to block the pain signals that come up from the back and lower extremities up to the before it reaches the brain, and we tend to overstimulate some of the larger motor fibers, which causes sort of a tingling sensation in the areas where they normally hurt. If you're a patient that had chronic back pain and chronic leg pain if you've been a patient who's had chronic back or leg pain for a period of time, to have this tingling sensation replace the sensation of pain is very rewarding for them.